Hi, I'm Joya Van Der Laan. I am the lead practitioner at Nourish House Calls. I am a nationally board certified family nurse practitioner, and I specialize in functional medicine, regenerative medicine. Specifically, I'll be talking about women's hormone replacement therapy in this video. There are lots of hormonal changes that happen throughout a person's life, especially a woman's life. And we get taught a lot about, or a relative lot, about menarche, about period starting, puberty, that sort of thing. But not as much, not nearly enough education and information is provided about menopause, and especially perimenopause. Perimenopause and menopause are words that many women are just not familiar with, or they may be familiar with the words, but they don't really know what those words mean, especially what perimenopause all entails. It's interesting because menopause is one day in time where you have gone without a period for one whole year. Now you are in menopause, postmenopausal, you have gone through menopause, however you want to say it. But perimenopause is that 10-year period before menopause, where there are lots of changes happening that there is very little education out there about. Thankfully, more and more information, especially on social media, is available, but what I really am passionate about is giving good care to these women, including myself pretty soon, and just educating about that so that we have the empowerment to know how to handle this time of life and know that we don't have to suffer through it. So what are some symptoms that you might notice going through perimenopause? I see this all day long, every day. I'm almost 43. I have noticed some changes in my sort of hormone symptoms as well. So I'm living it right there with you. And like I like to say, menopause, perimenopause is coming for all of us. It is something that happens to literally 100% of women at some point. So we really all need to know more about this. So what are symptoms that you might notice or experience during this perimenopausal time period? So weight gain, anxiety, depression, sleep disturbances, so poor sleep, especially waking up at 1 to 3 a.m., can't fall back asleep, mind racing, that's not usually who you are. That belly fat gain, certainly hot flashes can be a part of that. Sometimes heavier periods or periods with more clotting, closer together periods. So I'll give you a personal example. My periods used to be 28 days, exactly predictable, no problem. Now they're 26. And it's interesting because I wear out an Aura ring, and so I can exactly tell when I ovulate, when my period's coming based on my temperature. And so it's a helpful tool to have, very interesting. Other symptoms that I hear a lot from women are irritability. I just don't feel like myself. My libido is terrible and I feel bad. Oftentimes they describe it like this: I wish I wanted to have sex. So the desire to have the desire is there, but it really is hampering and kind of harming in some cases their marriage relationship when the libido is low and they don't know why and they feel broken because of it. And then of course vaginal dryness is an issue. I just saw a patient yesterday who literally bleeds during every pap smear, and certainly hasn't had sex in the last number of years, few years, 3 years I think she said, because it's so painful and so dry, and she bleeds every time, and they've just kind of given up, and that made me so sad. So what can we do about this? Well, one of the things that I love, because it's so impactful both for the symptoms that women are currently experiencing, but also for prevention of future issues that can be caused by low or imbalanced hormone levels, is bioidentical hormone replacement therapy. We can call it bioidentical, we can call it menopausal hormone replacement therapy. It's a lot of similarities there, more similarities than there are differences. So the way that I approach it is in a very individualized way. I recommend doing the Dutch test. That's what I order on almost all of my hormone-related patients, females especially. And we get a good look at all of your hormones. So we'll get a look at progesterone and how it's metabolized, estrogens, we have 3, and how those are metabolized, testosterone, big deal for women. DHEA, we can also tell how testosterone is metabolized so that we can avoid those common side effects of acne and hair growth. I don't typically have those in most of my patients because of the way that I approach hormone replacement therapy. The goal of bioidentical hormone replacement therapy is to safely replace hormones that have tanked when we're in perimenopause or menopause. So these are not artificial hormones. These are hormones that are exactly chemically, structurally the same as what our body makes. Now, this would be as opposed to something like Premarin, for example, or the birth control pill, which are synthetic, non-identical chemical hormones. And there's disadvantages to those that I won't get into in this video, but may touch on in other videos. Hormone replacement therapy can have so many advantages, like I said, both for current symptoms and future prevention. For future prevention, I always touch on bone, brain, and heart. It helps to prevent osteoporosis, which is a major risk factor for postmenopausal women. It helps to prevent dementia, which is a major risk for postmenopausal women, and it helps to prevent heart disease. Again, another major risk for postmenopausal women. But let's not forget about the symptoms that are happening now that are disrupting your life. The hot flashes, the mood changes, the poor sleep, the lack of libido, the vaginal dryness, the weight gain, the anxiety. Hormone replacement therapy can be so beneficial with that if you find somebody who's willing to individualize your dose using typically oral progesterone if you have a uterus, and then topical or cream forms of the other hormones, including estrogen, usually E2 estradiol and E3 estriol, and then DHEA and testosterone, any combination of those. And they can just be applied topically either to the skin or even vaginally or to the labia. The other thing that I test in addition to hormones in women is a complete set of blood work. So including ferritin, complete thyroid, complete metabolic reading, including insulin resistance and inflammation, so HSCRP, and then a very complete lipid or cholesterol panel, including not only your total cholesterol, LDL, HDL, and triglycerides, but also your subparticles, so small LDL. We're looking at the lipoproteins, so apolipoprotein B, lipoprotein a, two really important factors to look at and track over time for determining cardiovascular risk. I also do nutritional testing through a company called Genova. I love the Nutrival or their metabolomics. We want to see if somebody is having any nutritional imbalances as well, because although hormones may be the biggest component of somebody's symptoms and risk, there are other things going on. And hormones are metabolized in part by methylation. And methylation, responsible for metabolizing hormones, is also responsible for creation and metabolism of neurotransmitters and of cell turnover. So talking about cancer and aging and all sorts of other things. Methylation is foundational, and this test gives me insight into how somebody is methylating, both in terms of a genetic point of view and also a nutrient point of view. The B vitamins, for example, are really important for methylation, and certain types of B vitamins, depending on your genetic composition. Because I practice from a functional medicine standpoint, that means that I'm always looking for root causes. Now, very often the root cause of hormone imbalance or low hormones is menopause. And after menopause, we're not going to get back the hormones. Our body is not going to produce those. And so that's why it makes sense and is safe and beneficial and wise in many cases to prescribe an individualized hormone replacement therapy regimen. But the other thing that we look at is sleep, exercise, activity, diet, stress management, and even relationships, because all of those things have a giant impact on your overall health, both health parameters that you can feel and health parameters that you might not be able to feel. There are some safety considerations that we want to keep in mind when prescribing hormone replacement therapy wisely and with an individualized approach. Certainly, concerns for breast cancer have come up. If that is a question that you have, I will do videos on this as well. But for now, what I would recommend is going and getting a copy of the book called Estrogen Matters by Avram Blooming. He does a fantastic job of laying out the research and the risks and the benefits of hormone replacement therapy and all sorts of little nuances, including a discussion about heart disease and breast cancer, all sorts of things in his book. I would highly recommend reading that to ensure that you are even more informed before you start any kind of hormone replacement therapy, or before you just rule it out as something that you don't think is safe or appropriate for you. Going through perimenopause and menopause is not optional. That is just going to happen. But what is not is your choice on how to deal with it and how to educate yourself about it, and on finding a medical provider like me, like somebody else who practices like I practice, who's willing to listen and work with you and counsel you and maybe even prescribe for you an appropriate hormone therapy regimen along with whatever vitamins, nutrients, minerals, diet changes, sleep changes you need to make. Really, this is going to work best with an all-encompassing approach. If you're curious about working with me individually, my website is nourishhousecalls.com, and you can actually book a free 15-minute discovery call. I have a cash-based practice, which means you're paying me directly. Insurance does not cover this type of care, unfortunately. And so I always want to make sure that I'm comfortable with you and you're comfortable with me before I have you sign up and pay anything. So you can book that discovery call online on our website, and I really look forward to caring for you and hearing from you.